Suppose the patient comes to the doctor, what he has to go through is a common question that the patient asks to the doctor. Now, whenever the patient comes, we will do a clinical examination in which we look at whether the patient is pale. That means to say whether he has lost blood through his stools or whether nutritionally he is poor, lost weight. All these things we can make out clinically. And also we would like to see certain areas like in the lower part of the neck or the abdomen, whether we can feel mass in the upper abdomen or we feel whether there is a distension which could suggest that there is ascites. Now, whenever patient comes to the doctor, first we assess him clinically. You look at the patient's general condition, whether he has lost significant weight or not, whether there is pallor, which suggests that there is anemia, whether the patient has any lump in the abdomen, that which may suggest that there could be a tumor that is filled through the walls of the abdomen, whether the patient has any ascites, that is fluid in the abdomen, which suggests that it is an advanced case of stomach cancer. In addition, we also look for certain areas like enlarged liver or the neck node, which suggests that the tumor could have spread to these parts of the body. So once we suspect that there is a possibility there is a cancer of the stomach, we do certain tests to confirm our diagnosis. Now, to confirm the diagnosis, the commonest of the tests that is done is the Upper GI Endoscopy. In this process, it's an outpatient process where outpatient procedure where we take the patient on an empty stomach early in the morning and put a tube into the stomach via the esophagus and look at the stomach. If there is a growth, what is the type of growth, the size of the growth, the extent, all that is ascertained, and biopsies, multiple biopsies are taken from the growth. Now, these biopsies take about 3 to 4 days to come back with the report, and which gives us the idea as to what sort of a cancer it is. In the meantime, we do certain blood tests to look at the status of the hemoglobin in the body, the level of proteins, and liver function tests, and many other tests to look at the general condition of the patient. Subsequently, we do either a CT scan of the abdomen and pelvis and that of the chest, or a PET CT to ascertain the stage of the disease. Now, once we ascertain the stage of the disease, we plan out the further line of treatment.